Welcome to Porchlight, a presentation of Porchlight VNA, formerly Lee Regional VNA, providing first-rate, highly personalized, short and long-term care for thousands of people in Berkshire County and the hill towns of Hampden and Hampshire counties, all in the comfort of their own homes. And the services provided by Porchlight are comprehensive and excellent. I'm very happy to welcome to the program two people who in part are responsible for that. Bonnie Wickham, who is a manager for clinical services for Porchlight, and also Gail Altman-Orenstein, who is a physical therapist. So both of you, welcome to the program. It's great to have you.
Thank you for having us.
So I think, Bonnie, sometimes people are surprised by the full range of services offered by a home care agency, because many times we think, well, you have to go into a facility to get a higher level of services, that sort of thing, hospital. But more and more, I think people are finding that this level of care in the home is such a great high level.
That's correct. We offer not only nursing, but a full range of rehab services, including physical therapy, occupational therapy, speech therapy. In addition, we have home health aides who can assist with personal care and medical social worker. So we offer a full range of services, and many times people aren't even aware that home care is out there until they need us, and it's presented to them from either a hospital case manager or someone in a nursing home to make sure that people, when they do return home, have the services that they need in order to stay safely at home.
So that's very interesting. So, and I think it's very common that you hear, well, people should be more prepared. But in all honesty, you probably see this quite often. Like you suggested, people aren't making these decisions until it's sort of thrust upon them. So what would you suggest to families, perhaps, whether it be someone who is going through a surgery, it may be an elective surgery, or if there is an illness that people are considering, well, perhaps we need some additional care?
Right. They should be aware that in order for people to return home, they really do need the services in place. They will start working on discharge planning either after a surgery or an illness, whether it, the surgery was planned, elective or not. We want to make sure that people return home safely. So the discharge planning will start either in the hospital or at the nursing home. Or sometimes we get referrals from doctors' offices that people are having difficulty being maintained in their home safely, or they have an illness that maybe didn't require a hospitalization, but they still need follow-up from a nurse, or if they've experienced some sort of decline in function, that they would benefit from either a physical therapist and or an occupational therapist as well, to get them back to where they are at their prior level of functioning, and that they can be maintained safely in the home.
And you raise a good point there, because many times people think, well, it's VNA, which is visiting nurses, and so people make the assumption that it's perhaps only nurses, but that can't be further from the truth.
Right.
For instance, we have right here, we have Gail, who is a physical therapist. And so, Gail, tell me a little bit about what you do for Porchlight. You're helping people really get back on their feet in their own homes.
Absolutely. And as Bonnie said, there's many types of surgery, elective and sometimes emergency or non-elective, and illnesses. A lot of the elective surgery nowadays is joint replacement. The baby boomers want to play tennis.
That's right.
And
or golf.
Or golf.
Walk their dog.
Or just get back to being comfortable and pain-free. They will usually go to their surgeon, and a lot of the surgeons will recommend some exercises they can do on their own just to get ready for the surgery, and things to think about prior to even going for a surgical procedure. If you have a two-story house, is there a railing? Are you going to be able to go up and down the stairs? Are you going to be able to get off and on the toilet? Do you need a special seat? So the therapist will come in when the patient comes home, or the client. We will do an assessment, determine exactly what type of therapy they need. The physical therapist may work on strengthening. We want to keep the patient as functional, get them back to function as much as we can, keep them safe. And also we work with the MDs on pain relief. After surgery, sometimes people are in a lot of pain, sometimes not, but hopefully that will be a short-lived situation. So the therapist will do strengthening exercises, work on going up and down the stairs. The occupational therapist would come in and work with, can the person get in and out of the shower? Can they stand at the kitchen sink and in the kitchen and prepare meals?
Because often people don't realize this, but in order to get around, it's the upper body strength that sometimes people forget about, because you have to be able to support yourself.
And a lot of people, we determine what type of device they would need to walk with. Do they need a cane? Do they need a walker? How much they should. We give them instructions based on what the physicians tell us in terms of if there's any special precautions, certain movements that they're not allowed to do. Sometimes you can't sit really low because that will force the hip to bend too much after a hip replacement. So there's lots of things involved, and we like to, I feel most of my colleagues in the agency, we develop a really nice relationship and motivate the clients so that they can recover as quickly and as best they can.
Yeah, and it's amazing how that is, because there is these sort of, okay, you know, as a therapist, you know how to stretch the leg out and to do these certain exercises and so forth. But really, what I found in speaking with patients, you know, over the years with rehab, is that it's really that sort of personal interaction, and dare I say it, sort of the psychological aspect of things that is probably as, or even more important than the physical side of things.
You want to motivate them. If somebody just wants to sit around, oh, I'm in pain and I had my surgery and I'm going to be fine now, but they don't want to exercise and they don't want to do anything, then their recovery certainly will not be as rapid as someone who's really puts themselves out to do their exercises every day and cooperates with the therapy.
Yeah, and Bonnie, again, all of this being done within the home, where people are most comfortable, first of all, being able to sort of navigate the home and being able to get around the home. It's the best way to do it is in that environment, and yet again, I think people may have this perception that they need to go to a facility for these types of services, but again, it can be done at home.
It can be done at home. Not that, to say that some people shouldn't go to a rehab facility for a short time, but we often do have joint replacements that do come directly home. If things are set up in advance, that they know where they're going to be sleeping, they know where if they can't use the stairs, that they've made arrangements to have bathroom facilities on a first level and so forth. So, but a lot of these services, a lot of the recuperation and recovery can be done at home. And I just also want to say it's not just for hips or knee replacements. If people have been hospitalized for pneumonia or a heart condition, or they've had some sort of surgery, a cardiac surgery, or just any type of lengthy stay where maybe they have not been as mobile as they previously were, you can lose a lot of strength very quickly by not doing your normal routine or getting up and walking. So we will work with the referring physicians to get therapy in there as well, to get just overall strength up and to help people prevent a fall, or if they come out of a hospital and now they need a walker, try to transition them to either to a cane or to, you know, not using anything. So it's not just for joints, it's for a lot of other disease processes where they may experience some sort of weakness or debility.
And with today's technology, I think it's probably something that has helped VNA and home care services, particularly for Porchlight, because this organization has invested significantly in technology, not only with things like the telehealth monitoring, which is a wonderful program, but also some additional technology, for instance, Gail, that you use each and every day.
Well, not only the physical therapist and all the therapists and nursing, we all use a tablet for our documentation. So if I go in to see a client and I look on my tablet, I can see what the note that the nurse wrote on admission and find out all these little nuances and any kind of information. I can see what the person's vital signs were when the nurse was there last. I can communicate with the occupational therapist, the nurse, and this all makes for so much better treatment because we're all on the same page with every patient, and it's really wonderful. I'm very, very pleased, working for Porchlight. I think they're a terrific organization, and all these things that we are given to help us treat the patients, it's good for the staff as well as for the patients.
And I think it is indicative of Porchlight's mission to, in part, serve the community as best as possible, and also as a nonprofit. Again, those additional dollars that come in, they're not going to stockholders. They are going back into reinvesting in the services. And Bonnie, that's got to feel good to work for a nonprofit that has such a long history, not only in the Lee area, but of course throughout Berkshire County.
Right. And to what you say, it's reinvesting back into the agency and to better the care of our patients and to help our clinicians do the documentation and have the communication that they need in a very timely manner. We have a program that works with the tablets where it's internet-based, and so we pretty much can get real-time information from the field when our staff does their documentation. It's not easy being a home care clinician. There's a lot of regulation and requirements in terms of documentation of what we need to do. And so it's very important that when people do their documentation that we get that in a prompt manner, and this system allows us to get that. So anytime, anywhere there's a cell tower, we can get transmission back to our main program so that everybody has access to that information, which is so critical. And also the staff can communicate not only they all have their own cell phones in the field, communicate with themselves, each other, and physicians. They can also communicate via note, where those notes are immediately faxed to the physician. So we have a lot of different avenues for communication and making sure that the data is all current and everybody is on the same page.
Having that information up to date is so critical, and I'm sure you see it time and time again. So, Gail, a great pleasure speaking with you. We're going to continue the discussion with Bonnie and also a former patient of Porchlight, Joe Furgal. We'll continue that discussion. So, Gail, a wonderful opportunity to meet you today, and we'll continue the discussion right after this. And welcome back to Porchlight, and I'm very happy to welcome to the program once again Bonnie Wickham, who is the manager of clinical services at Porchlight, and Joe Furgal, who is a man who wears many hats. He's a former patient, and that's one of the reasons why we have him on today's program. So, Joe, welcome back to the show. It's great to have you.
Thank you.
So we talked about with Bonnie some of the wide range of services provided by Porchlight, and you've seen some of those services not only with yourself but also with your late wife, who had Porchlight in your home. But for you, you had at least one knee surgery and then another procedure more recently, and you were able to have rehab in your own home.
Yes, that's true. 3 years ago, I had my right knee replaced, and it was just great, the whole process, to understand it and to see it in action, actually. You hear a lot about it, then it actually happens to you, and you say, oh, wow, I have to do that. But the excellent part of it was that I was warned by a friend who played tennis and golf with me, and he said, whatever you do, make sure you get in shape a little bit before you go. So I wrote about, a good half hour for 4 or 5 days a week on an exercycle for about 3 months before I had the surgery. So then I went in and had the surgery, and after 3 nights in the hospital, they released me, and I arrived home late in the afternoon, and the next morning, though, the Porchlight VNA was right there and ready to get me moving. And,
get you back on your feet
right.
pretty quickly. Now, it was Dr. Mitz.
Dr. Mitz,
Dr.
right.
Kevin Mitz from
Yes.
Berkshire Orthopaedic
Yes.
Associates who performed the surgery. And as usual, he did a tremendous job, I'm sure.
Oh, fantastic.
But that was a few years ago that it was the full knee replacement.
Yes.
So that's a pretty significant procedure, not only with a new knee, but also even just the wound that has to heal up from that. So it's a combination of things.
You have to make sure, of course, that you look out for infection and a variety of things. But the main thing was I was amazed at how quickly they got me back on my feet and started to move me around even in the hospital. And then they taught me how to go up and down stairs. They put a little block of stairs out there, and I said, "You got to be kidding me! I'm not." But they taught me, and it worked well. And it didn't. I was worried about the minute I was looking for pain, but Dr. Mitz and his colleagues have done a great job with pain up there now too, and that's a big part of the whole procedure. But once I was home. The next morning, the VNA was there to check me out, and everything seemed okay. And then they brought in a physical therapist, and that's when I started to worry, though, because
that's when the real work
they started to move the knee around a little bit, and it you have to stretch it a little bit, like they say, no pain, no gain. Well, I was worried about that part.
After a knee replacement, a little stretch
right.
feels a whole heck of a lot more than a little stretch,
Right.
I can tell you that. But Bonnie, one of the things that Joe talked about was that sort of transition from the hospital after surgery with Dr. Mitz and a few days in the hospital, then to home. It's important to have that transition be very smooth, I would assume, for the patient.
Yes. And we certainly pride ourselves in trying to get in to see the patient within, if for a new knee or something real fresh like that, the next day, certainly no later than 2 days later. And we tend to see a patient more frequently during those first few weeks. Nursing will go in more often as well. Therapy does more frequent visits. There may be some other interventions that we need to do. Sometimes people come home on anticoagulants, and that has to be monitored very closely. There's a lot of teaching as to what to expect, signs and symptoms to report. So we try to see them pretty frequently when they first come home and make sure that transition is smooth.
And for that, it wasn't just a physical therapist. I assume there were others who came in. So what was the sort of regular week? Not that there's ever a regular week after knee surgery, but what was the routine like for you?
Basically, what I saw mostly was a nurse would stop in and check the wound and make sure everything was going there. But the therapist was there quite frequently.
Yeah.
And it really helped, though, because she taught me a variety of, I must have had 6 or 7 different exercises. And being the type of person I am, I just, I always think more is better, but that's not necessarily the case. But I really didn't have any problems, and the knee improved, and within 3 months I was back on the golf course, and that to me was very important.
And that probably, to think that you had a full knee replacement and to be back on a golf course in 3 months,
right.
Obviously you must love golf, to begin with. However, to think that even just a few years ago, that probably wasn't a reality after a knee replacement, or at least several years ago that wasn't a reality.
Yeah, several years ago, but I think in the course of modern medicine and how surgeries have progressed, I think it's certainly realistic for many patients that they should be up and running, and even better, after a few months after the surgery.
So it can be done, and it can be done at home, again, right. as we discussed. So recently, I believe it was your other knee, I think your right knee, that
my right knee has the titanium knee.
Has the titanium, so it's your left knee
and so Dr. Mitz, again, he's been my savior when it comes to my knees, obviously. Great doctor. And Berkshire Orthopaedics does a great job on all this. But
I'm sure the check is in the mail, too.
Yeah. And Dr. Mitz, though, did a scope to my left knee this time.
I see.
And that was on January 4th, I think it was, or January 11th, and I played golf on March 8th or 9th in Florida. So that worked out very well too. And I have no pain there now, so that's the nice part.
And also, we talked about earlier that you saw another side of Porchlight services with your late wife,
Right.
as she needed services in the home, and also able to take advantage of the telehealth monitoring system
Right.
within your home. So, tell me about that, and again, it being more than simply the clinical, what people think of as the clinical side of things. There's a compassion, and then there is a caring side that's so important as well.
Oh, yes, there's no doubt. The VNA was there whenever she needed them, but the important thing, I think, with the telemonitoring system is that it can be done in the home, and that means a lot, I think, to the patient. And especially like if somebody is not ambulatory, then that makes a big difference when they can't get up and go, for a doctor visit or a nurse visit very often. So having the telemonitoring system there available to it, especially on bad days when, of course, if they have trouble walking, you don't want them to go outside on ice or anything like that. So that was just fantastic. But just the coming and changing for wounds, changing bandages, etc. The VNA was just fantastic in helping her through a lot of that.
And we've talked to Bonnie quite a bit about the clinical side of things, changing for wounds, changing the bandages and that sort of thing, and all the wonderful things you do. There's also the home care side as well. So it really ranges from highly clinical to more of a service that's a bit of a step down, so to speak.
To speak, yes, we have two sides to our agency. One is the certified, what we call the certified side, and that's where the nurses and the therapists will go in for an acute illness and help see people through a recovery or transition to a different level of care. And then on the other side, we have Porchlight Home Care, which mainly consists of about 150 home health aides, and this is to really keep people in their homes. People can through many different resources, whether it be collaboration with elder services, private pay, long-term care insurance, have an aide come in their home a few hours a week up to a live-in. As baby boomers are aging and people really don't want to spend time in a nursing home, it's a great option to keep people in their home safely.
And sometimes, really, it is only a few hours here or there, or even less time, that can make a world of difference,
Right.
whether it's just doing a few household chores, that sort of thing, giving these individuals a little bit of a boost. It can make a world of difference.
Absolutely. It could be just an hour in the morning 3 times a week, or maybe a couple hours a day for personal care, to assist with shopping, meal prep, just to make sure that people are getting all of their needs met in a safe manner.
It means so much,
It
and
does.
I think it means so much to keep people in their home. I know, Joe, for you, it must have been so important and meaningful to have your wife be at home.
Oh, it's obviously it was great for the whole family. She could see the grandchildren regularly. They'd stop over and see her and everything, and our daughter would be there. So it just it makes a big difference to have this service available to us.
And for you also, for your rehab, to do that at home, it's got to be far more comfortable. Again, being in the hospital, being in a facility, generally people feel more comfortable being in their home.
I think the big thing there is that you find out that there's a lot more you can do yourself and to move the recuperation period along. And that helped immensely, because they teach you a lot of things and a lot of different programs or exercises that you can do to improve the whole situation.
And Joe Furgal, a great pleasure having you on the program. Bonnie Wickham, who is the manager of clinical services, registered nurse. How can people learn more about Porchlight for the VNA services and also home care? Sure.
They can call us directly at Porchlight VNA at 413-243-1212. We also have a website. They could Porchlight Home Care porchlight.org. And we're also on Facebook, if you want to look us up on Facebook, Porchlight Home Care. And if you're interested in our private services for home health aid, that number is 413-243-1122. But certainly calling the VNA, we can get you in touch with the folks over at the home care side as well.
Sure, it's an easy enough number to remember, 243-1212. Of course, it's area code 413. Bonnie, a great pleasure. I've learned so much about Porchlight here on this program, and Joe, not only a patient but a board member too, so it goes beyond simply just receiving services. You're committed to this organization. It seems like it is a wonderful one, so thank you very much, Joe.
Thank you.
And Bonnie,
Thank you
very
for having
much.
me.
And this has been Porchlight, a presentation of Porchlight VNA and Home Care. Thanks for watching.